Hi, I'm Dr. Nick Vial, and I'm a board-certified plastic surgeon. I've been working with breast cancer patients for approximately 12 years, and I've been practicing in Bend for 7. Our team is unique in that we have a lot of experience with breast cancer patients and dealing with this diagnosis in a compassionate way, which helps people think about where they want to be in the future. I think we really encounter different types of patients, some patients that have a really complex breast cancer, and some patients that don't. And within those groups, there are patients that are very concerned about what they're going to look like, and how they fit into clothing and their confidence and how people perceive them. So there are those types of patients. And then there are other types of patients that really care about getting out and rock climbing as soon as possible and not wanting to have a lot of interventions, but instead just getting back to their lives. So I think our experience allows us to look at these different patient populations based on their diagnosis and their goals, and guiding them in a way that we know will lead them to success. And that can look really different from person to person. And I think that it really is experience that lets us look at a person, look at their body type, look at their diagnosis, and say, this is where we want to get you, or this is what's possible. And I think this is also an important time to discuss how to decide where you want to go on your journey, because a lot of times patients will be put in a direction which is based on maybe what happened to their friend or what happened to a colleague. But everyone's diagnosis is unique, and what you really want to do is you want to step back and say, where do I want to end up? So when you're starting the journey and you're picking either a breast surgeon or a plastic surgeon, I think the most important thing is to look at where you want to be. And again, I can't stress enough how important it is to look at people's work and to look at their outcomes and to look at how their patients feel about them, and taking them through that process. We have a team that works with one another all the time. And what I decide and what I do is not in a box, but it's based on things that I discuss with Dr. Walling, that I discuss with our physician's assistants, that I discuss with our staff. And we really try to nurture the plan towards the patient. Our staff really cares about each patient and really cares about their journey and really cares about making sure that they get through this process unscathed as possible, because this process can be hard, and it can be something that really changes people's lives. And the unique thing that we can offer is that everyone on the team has done this before, has done this with other patients, and we know how to get results that are outstanding. And I think that really comes from my knowing what Dr. Walling's going to do, her being able to look at somebody and say, I'm concerned about this, can you do that? Or a lot of times we'll talk about what side are we going to start on, just because we want to make sure that we're each thinking about what the other one is thinking about in the final outcome.